was going to ask you about the spinal subluxations. If you are having spinal injuries or some of those are blown out, is there any chiropractic or suggestions that you have as far as treatment?
Yeah.
Cervical, thoracic, the lower lumbar, all of it, people are usually pretty well gone by the time they're...
It's not. I always hate it when I see the radiologist say age appropriate. It's like, screw you. No, but the thing is, and I actually, when I first moved to Arizona, my clinical practice, I've been in practice for 31 years now. The oldest patient I ever saw was a 98-year-old Navajo woman up in Flagstaff when I first moved out here. That's when I met Cheryl. And the youngest patient I've ever seen is 6 weeks. Okay, and the reality is I've had 80-year-old people that have no arthritis. Okay, and I've had 20-year-old people, like especially up in the res, where these kids are rodeo and all that stuff. And if you fall and injure yourself and you don't fix it, it's going to wear out quicker. And it's just like car tires. Now the whole subluxation thing. Okay, the way my therapy works is you have 24 segments of your spine. Whichever one's ligaments hold stuff together, bones together, and whichever one gets sprained is generating the pain. Okay, so the way chiropractic applications work is you never ever should be adjusting the segments already moving too much, and that's the reason people have failures. So you get the joints that don't move, which is the word subluxated. Okay, but both of them have the same effect because you're activating gravity receptors. Okay, and getting back to the whole pain pathway, you got one nerve that tells you got hurt pain, and there's got another nerve I activated blocks that pain. That other nerve affects 3 big things: tone of a muscle, balance, circulation. So I'll see people all the time that don't have pain, but they've got a movement disorder as far as the tone of the muscle. Is it too tight? Is it too loose? Okay, or is it an epileptiform activity, which means it's like a light switch, it's not on or off. Okay, so yeah, does chiropractic by itself help people?
Up in this area, how is that function with the vision? Does it affect any other parts of the...
Well, yeah. Remember the sperm and the egg? Okay.
I was there.
You were there. All right. So what happens here is, we talked about the 12 cranial nerves. So your lower brain stem is your pons medulla. And when you look at eye exercises, for the most part, they're pontine horizontally. Vertically, you tend to be more mesencephalic, okay? But depending on your injury, if you suffered a whiplash, and I see this all the time where people, their skull, everything in medicine has all these words. It's either doctor's ego named after it, or, like Dr. Morton nailed the foot. If your second toe is longer than your first, Morton's toe, okay? If you have a neuroma on your foot, it's called a Morton's neuroma.
It's a lot to remember.
Yeah. But I mean, most stuff is either doctor's egos or Greek or Latin derivatives. But once again, if you have irritation of your lower brainstem, and then you got to realize your chord's an extension of your brainstem, and then your periphery is an extension of your cord.
So that sounds like something to require maintenance if you really had severe injuries in that area.
Yeah. And you see, that's why, especially a lot more of my neural patients, I don't even adjust them that much. I give them more physical things that they got to do at home. So. And again, your choice is, whether you're trying to prevent Alzheimer's, whether you're trying to prevent Parkinson's.
We had a friend who was just recently almost diagnosed with Parkinson's who wanted to come tonight, but he ended up in the hospital with the condition. So we're probably like.
And it probably was something related to his gut or heart or lungs.
I think so. I think I call it death by fork. People stuff in their system that they short.
Yeah. And you see that's why a lot of times, blood work is kind of an eye opener for somebody if they haven't, in a probably, if you want to have a best state of health, okay, you got to do preventative. I mean, nobody argues that it's like, wow, I should never get the oil in my car changed.
You work on any saliva testing or any of those kind of things? Because
the 3 things if you're over 40, and again, I showed you the foundational assessment here.
Yeah.
If you look on the back side, if you're over 40, you probably should do your hormones.
I'm trying to get it.
Okay. And again, if you're over 50, it's maybe not be a bad idea to do your cancer panels as well. I do that. It's called, if you look on the foundational thing, it's called the cortisol AM that's listed there. And, you can argue it's like what's better, a BMW or a Ford or a Mercedes. Some people think that salivary testing is better. Some people think, doing your blood test. But the bottom line is, it's just like anything else in life. Okay, if let's say you want to be a better athlete, you run a mile and it took you 10 minutes, and then you're
the
actually...
empirical knowledge makes a difference because you have the round experience that you're...
Yeah, but it's one of these things that it's like it's anything else you train at. If you train at something, you go from 10-minute miles to 7-minute miles, you did training to change that. So it's just, you're looking at blood work that you should do yearly anyway, especially if you're over 40. That's what I'm saying.
Thank you.
Yes?
I would be remiss if I didn't say something, so I just want to say that Dr. Burdorf, he was one of the first people that I trusted with my neck, with my subluxation. So I just want to say, from a long time ago, I've trusted him with adjusting me, but I have never seen you present, and I am very impressed, and I want to come and visit you about this.
Well, thank you. Thank you, Cheryl. All right, the way we all, I graduated from Chiropractic School, and 5 of us came out here. We graduated April 16th, 1987, and then the Arizona boards were offered about 2 weeks later. So myself and a friend of mine, Troy Freiheit, and 3 other chiros, we came out here, and then I had a job offer. I just took Arizona for the hell of it. I thought maybe I'd want to retire out here someday. And then at that time, state boards were offered twice a year. So then I took my Minnesota boards and I had an offer there. So I stayed in Minnesota, and the following February, Troy calls me up. It's about 100 below wind chills. And it's like, do you want to move to Arizona? Which I did, and I worked for Dr. Dahl up in Flagstaff for about, what was a 3-year deal. And Troy was about a year in front of me, but that's how Cheryl and Troy dated back then. So. But
So, yeah, so, great guy.
Well, thank you.
My testimonial and edify him, I just think it's great, so.
Appreciate that.
I'll be coming by to see you. so.
Okay, awesome. Any other questions?
Is there any way of unraveling, say if you got hit with a blow, it would be normally a lethal blow, taking it to the nasal area and it rotates your neck? Do you have any thoughts on that to be able to,
Yeah.
I mean, there's probably other complications involved. but-
Well, okay, I mean, it's like, this is the way it works is, and you're talking about what I said earlier about sports, and, you know, the bad sports are the NFL, concussions, hockey, girls, soccer, okay? Yeah, boxing, yeah, I've been,
Mixed martial arts, oh, it's amazing.
well, if you go on Instagram, Henry Cejudo, I've been his chiropractor forever. He was in my office today. He won 2008 Olympics for wrestling, and now he's a UFC fighter. And he's turned 30, and I keep telling him he's got the title fight coming up on August 4th, and I go, dude, just get it and retire.
Yeah, I think
Save your
people
brain.
should get adjusted when they come down the birth canal. I think it should start from then.
It can. It's like anything else in life. If you address it quick,
Yeah.
you know. And I see this all the time where I'll have like a mom and a kid get in a car accident, and the kid I see a few visits, and the mom will see for months. You know, so but it just, yeah, you don't. The sooner you can address the system, you got a better chance. That's anything in healthcare.
And your adjustments then are their Palmer School of, or yeah?
That's really old school, Palmer.
Yeah, it is.
Yeah.
I was born yesterday.
No. Okay, everything I do is neurology based, and you see, it's not about if you truly have a pinched nerve, you need a shot of cortisone, you need surgery. Okay.
So you integrate.
No.
Okay.
It's everything about chiropractic is getting joints that don't move to move, and that may be a hands-on adjustment. That may be a drop piece, and again, doctors love to name stuff after themselves. So good old Dr. Thompson developed Thompson technique, which was drop pieces. First chiropractor we went to was Arlen Four, Dr. Patton, Dr. Lee in Redwood Falls, Minnesota, developed activator technique.
Mm-hmm.
And activator is basically, Maureen Toll's a friend of mine. She's a dentist up at 40th and Bell, and I've known her for 20 some years. And anyway, what she does is her patient base is usually special needs or trust fund babies that got hooked on drugs, and now they need like 10 procedures at once. So she does anesthesia, dentistry and anesthesia. And Chad, her office manager, was in a car accident a couple of years ago, and he comes in and it's like the activator technique. You know what that was?
Yes.
Dental mallet. They use it to knock teeth out of people, and what these doctors did is it's a very low force adjustment, which you got to go with the body type. For some people, a low force adjustment is probably best. Okay, and for other,
There's a lot of different things. So
there's a lot of stuff you can do. I mean, I'm not.
I In hearing what you're saying, it seems like you have a vast amount of experience and you've integrated it well, what would
Yeah.
be beneficial for the patient.
Yeah, I try.
like that,
Yeah, so I co-manage a lot of patients with other doctors, and there's some people come in, it's too late, get an epidural, come back in a month, and I can actually rehab you. So I do a lot of exercise stuff now.
Thank you.
Okay. Hi.
What do you think of the nerve root ablation route?
Well, I had a good friend. It's in theory everything works. Okay, so you see, once you rule out fractures, cord tumors. Okay, most pain when you're talking spinal problems is disc or joint. Okay, and the most simple thing to do if it's a true disc lesion is do an epidural. Okay, and we talked about half-life. Okay, half-life is roughly 6 to 10 days. Okay, and the best analogy I can give you is, let's say you're healthy, you go skiing, you break your arm, you cast it for 6 weeks. So that's like a 2-week progression, 3 half-lives. Okay, now when you take that cast off 6 weeks later, what happened? Did it get bigger or little?
Smaller.
That's a bad half-life, isn't it? So most pain management docs, and these are my treatment plans, most of my treatment plans are about 6-week windows. You know, same difference when it comes to pain management. They'll probably give you an epidural every 7, 10 to 14 days, three of them in that window of time. And if it works as a disc lesion, great. Okay, if that didn't work, then they're going to talk about probably doing a laminectomy, which is surgical. If you got a joint problem, what radiofrequency ablation is they go in and they kill the nerve off. And I've had patients that have had it done and they've been good for 5+ years, and I've had other people that have come back to me in 6 months.
Okay.
So the big thing is a lot of times, whether you're doing interventional medicine like that, is you always got to go back and address the postural muscle tone. Okay, and the postural muscles that hold your spine together are like the size of your fingers. If an anatomy dissection, I decide to do that to you, I won't. Okay, but they're that big. Okay, and just like I said, these eye exercises, just when you track your eyes, you're activating them. So if you activate those joints, those muscles that are sprained, those muscles that are around the sprained joints, you can stabilize it. And if you don't, that wear and tear on your body is just going to keep promoting arthritis. So.
Okay, thank you.
You got it.
So if the neck muscle did move,
I'm sorry?
if they didn't move up, like.
Then we got to work on your postural tone. Okay. So I mean, there's everything I kind of trying to give you here is a lot of stuff that's really low-tech rehab, and you know, you can literally do a whole body workout on an RX balance pad with another $10 of exercise tubing. Okay, you don't need a fancy gym membership. But the problem is, if you don't have good postural tone, then that tells me your cerebellum's not working as well. And if your cerebellum's not working as well, that's eventually going to make your frontal lobe and your basal ganglia, which can give you Parkinson's or Alzheimer's,
Is
increase.
your cerebellum back here?
Yeah,
I have, Chiari-1 malformation, is that?
Chiari. Yeah.
Side effect?
Once again, a Chiari malformation is when it's sometimes associated with spina bifida, but what happens is you got the foramen magnum, which is, foramen means hole, and so basically that's the base of your skull that's now connected with your cervical cord. And what happens is, in a Chiari situation is, and there's 5, if you're a grade 1, you probably are nothing to worry about, okay? But if you get, 3s, 4s, 5s, that's a lot of times you have to have a surgical fusion of your neck. Okay, but it's what's happening is basically your brain is unfortunately kind of pushing out, and your cerebellar tonsils are the first thing to be coming out through that foramen magnum. Which means all the more reason you should have a strong neck. Because I got a girl that I saw that she was a naturopath student, that she moved out here, and she got in a car accident. Getting in a car accident, I mean, she already had surgery before. Okay, and you get in a car accident, surgery doesn't make you stronger. So surgery will never make you as strong as your original parts. So these are things that, if it was me, I'd be doing eye exercises.
Do you
Or
have a book?
postural exercises.
Do you have a book or something
No,
you've written that you should?
I wish I can give you basic stuff, and one thing you can do is go ahead and subscribe to my YouTube channel, because I got little simple videos on there. But the thing is like when you give eye exercises, sometimes you got to do them in just one plane. And you can't go both ways. You know, it's kind of like if you got a big arm here and a little arm here, and you exercise both of them, the big arm just keeps getting bigger. So a lot of times I have to do one-sided things with people. So, but as far as if my YouTube channel, if you just get a balance pad and some exercise tubing, you can do a nice little routine that'll take you 3
Pass
minutes.
that bottle over here. I have to try your.
Try the sniff test.